So hi guys, again welcome back to my videos. So today is different. I'm gonna start a series about residency, about what is OB-GYN residency, what to expect, what not to expect, how it is throughout the 3 years. When I was going to join the residency, I searched before joining and before applying also. I searched in internet about the life in residency. It was not in details. There were few videos. Some told that it is difficult, but at the end it is worth it. Even my seniors, whom I contacted over phone, I asked them the same thing, and they told me the same thing. It is very hectic, difficult, but it will be worth it at the end. So people will always talk about the start, that is the difficult part, and the end, that is the worthy part. But no one talks about what goes in these mid 3 years. Okay. No one talks about how hell and heaven it can be for you. So I am here to talk about that only. So I have started this series. There will be few videos in this series in which I'll be talking about, the first month realities, the labor room duties, how to go about your residency, about academics, thesis, what to expect, not to expect, many things in details, in minute details, which I have faced from my personal experience. So today is a broad overview, and so let's begin. In in the meanwhile, you can ask me whatever you want to. And this video is specifically for those people who are going to join OBGYN residency, who are interested in joining the residency, and who is already in the residency. So these are for you. Okay. So if you are an MBBS student or an intern or a pass out or a resident, please watch this, and I hope this will benefit you. So why OBGYN is unique? You are going to take a subject for 3 years. You are choosing OBS and Gynae among all the 19 subjects. So there must be something unique about it, which you have already felt. So why it is unique? There are few points. I'll talk one by one. First, the experience. Okay. Here you will experience some of the most happiest and the most critical moments in medicine. Happiest because there are births, you see babies, you see a new life coming, which you will not see in other specialties. And critical because, like in other subjects also, here in also there are emergencies, there are lives lost, maternal, fetal, gynae patients. There are some moments which you will make you feel that you have not done enough, but you have done whatever you could have, but you will feel that you have not done enough, and this will make your moments more critical. So there will be many happy moments when you first time conduct a delivery. You will feel on top when you first time do a cesarean, when you first time do a hysterectomy, or when you first time manage any emergency in obs and gynae. You will feel really happy. So you will experience, as in other subjects also, here also. Okay. Second is, you care for two patients at once. So your two patients are mother and the baby. So in obstetrics, you are managing a mother, but at the same time you are monitoring the baby. So here you are managing two patients at once. Number three, emergencies are unpredictable. Yes, like in other specialities where emergencies are unpredictable, here also. But what makes it special is because suppose a case is going normally. Okay, you are conducting a normal vaginal delivery. Patient is very low risk patient, and baby has been delivered uneventfully. You have done everything fine till now, but again suddenly there will be a PPH, and you will be very stunned, and you will be lost at first what to do, what not to do. Eventually you will learn with time, but sometimes it will be so unpredictable, like shoulder dystocia and everything. You will be very puzzled, but that is how you will learn. And when you are finally able to manage those cases, you will be very happy. Number 4 point is combines both medicine and surgery. If you love medicine and if you love surgery, like me, I love both the subjects equally, medicine and surgery. And that is how I made the choice that I'm gonna choose obstetrics and gynecology as my upcoming specialty. And that's why I chose this specialty, because you are in a patient, like if you are doing one, cesarean surgery or any hysterectomy in a patient, if that patient has hypertension or heart disease or any neurological disease, you are going to optimize that patient for that disease first and then take the patient for surgery. So you are managing both the medicine part of the case and the surgical part of the case. And never think that after coming to gynae you will just forget about medicine, about like ECG or ABG or others. Your only focus will be uterus and ovaries and fallopian tube. No, you are wrong. If you are, willing to learn enough, uh, you will never forget all this, because your patients will keep coming with all these, disease and all these complications, and you have to manage both the parts, medical and surgical. Number 5, and the most, the lovable part of obs and gynae, that it has immediate impact on your patient. So when you see a mother delivering a baby and you hand over that baby to the mother, and the mother is crying, but she is the happiest at that moment. And when she thanks you back for giving her a healthy baby and keeping her safe at the same time, that feeling is, you know, cannot be expressed in words. So those things have immediate impact on the patient. In other specialties, suppose surgery or any other, pediatrics or medicine, um, it is a long path for a patient. No one comes happily in other specialties. But when a patient comes in obstetrics, she expects happiness at the end. She expects that, okay, I'm gonna go, I'm gonna have a healthy baby, and I'm gonna come back with a healthy baby. And all the family members are expecting the same out of the department. So the impact period is so near. You are doing cesarean or normal delivery, whatever, you see the happiness instantly. And um, one of the way of seeing this is, like when I was first year, I did not get time for proper food. So whenever I was hungry, I used to go to labor room, because I knew whenever I go there will be sweets and I'll get sweets to eat, and okay, my hunger will be gone for some time. So labor room is the only place, obstetric ward is the only place where you people will give you sweets for their happiness. You will never see it in any other specialty. Number 6, emotion spectrum is very wide. As I told you, it will range from from the ultimate happiness of a patient. If suppose uh, there is one patient who is married for so long, they are unable to have a baby, and they come to your hospital and then they deliver a baby. You can never imagine how relieved they are, how happy they are, how blessed they feel to have that baby. So their emotions are at the peak of happiness. And obviously, like elsewhere, if something bad happens or some bad outcome is there or some complication is there, there will be sad emotions, which you see everywhere. So in gynae also, in obs also, you will see that emotions, but here you can see the happiest emotions also. So the range is very wide. Labor room is a unique learning experience. There you will be on your toes. You will be managing, 10 patients, 20 patients, 30 patients at a time. Will be knowing each and everything about the patient, and you will be very quick. Your reflex will develop very quickly in labor room. I'll talk about these things more in details in other upcoming videos. Here I'm just giving you insight why you should choose obs and gynae if you are thinking about to choose it. Okay, I'm not telling someone who is not interested at first in obs and gynae. This video is not for you. This video is about them who has some feelings about this subject, who wants to choose this subject but confused if they are going to do the right thing or wrong thing. So this video is about you. Here every day will be different. One day you are in OPD, one day you are in labor room, one day you are in OT, one day you are in antenatal clinic, one day you are in oncology clinic, one day you are in fetal medicine. So every day will be different. So ultimately everything comes down to this. It has emergency, it has surgery, it has emergency care, it has long-term patient relationships. Like uh, many patient remembers which doctor delivered their baby, and they will remember that doctor for a long time. How you behaved with that patient during her delivery, how you behaved with her during her hospital stay, how support you have given her. So she will remember for her lifetime, both the parents. And it has some life changing moments which you will see when you become a resident. It is demanding, obviously. I'm not telling that there is only bed of roses. There are many, uh, many bad days, many challenging days, many days in which you will question yourself why you have chosen this. But ultimately, it will be worth it. Like everyone says, I'm also telling it will be worth it. But yeah, there are challenges. There are, demanding days and unpredictable days, and many days are exhausting. But many specialties, most of the clinical specialties are exhausting. Likewise, this also. But this is what makes it rewarding at the end. So thank you for watching this video. I hope I have helped you in, towards your decision, if you should choose or not choose. These are not the only things. There are very minute things and many, you know, um, everyday challenges, many different challenges in obs and gynae, which I'll be talking in further videos. So stay tuned for further videos. And obviously, I'll be continuing my teaching classes also alongside. But this is one series, and I'm gonna, express and share everything with you which I have gone through my residency. Whatever I have learned, whatever I have experienced, and whatever I think that people should know about residency before joining it. Okay. So I hope I can lessen your tension, your worries, and your queries about residency. Thank you. Thank you for watching this video.